This baby is sleeping peacefully in the middle of the controversy strolling through hospitals in Hong Kong. There are not enough beds for expected mothers and not enough doctors to handle the volume of births. Double no pregnant women, which means pregnant mainland women whose husband and they themselves are both not Hong Kong permanent residents are crossing the border into Hong Kong to give birth, is an overwhelming phenomenon. According to statistics, over 40,000 babies were born in Hong Kong by double no pregnant women in 2010, 60 times more than the 2001 figure of 620, putting tremendous pressure on the local medical system and education system. Many Hong Kong mothers express that they have difficulties in finding beds in both public and private hospitals because most of the quotas go to rich pregnant mainlanders. In 2010, even if the Hong Kong government has suggested some ways to stop the mainland mothers from coming to Hong Kong, there are still more than 900 of them give birth without making reservations at the local public hospitals. The action of gate-crashing local emergency wards give extra workload to busy doctors and nurses. The service quality is definitely affected, which is not fair to those who have booked. It's also very dangerous to both baby and mothers, who can bear the responsibilities if any accident occurs. Another reason of Hong Kong people fighting against mainland mothers is because we have to pay more taxes for their kids' education expense, especially in North District. Our government has to put extra resources on both kindergartens and primary schools because the supply of school places is insufficient to meet the huge demand of non-local students. They are taking the advantage of Hong Kong people. The question is, why do mainland mothers flock to Hong Kong? They all wish for one thing, the permanent Hong Kong identity, which entitles the person to access the territory's comparatively generous social, health, and educational services. Some people said perhaps increasing the fee of obstetric service can solve the mainland pregnant women, but obviously it's not gonna work. The wealth of mainlanders nowadays is beyond our imagination. They are willing to spend a huge amount of money to let their kids enjoy a better growing environment. Some people suggest the public-private hospitals should not help the gate-crashing pregnant women deliver babies. Personally, I don't agree this practice. It's not ethical to put people's life at risk. After all, we are all human beings. Every life is a precious gift from God, and we do not have the right to judge whether a baby should be born or not. The only solution to curb mainland's invasion is to stop giving the permanent Hong Kong identity to those kids who were born in Hong Kong but their parents are not Hong Kong permanent residents. The Hong Kong government should work together with the mainland government to re-establish the right of abort in common law in order to solve the problem at root cause. It would definitely bring positive effects. If the pregnant mainlanders cannot get a Hong Kong ID card for their kids even if they're born in Hong Kong, the desire of giving birth here would definitely reduce. They will not be willing to spend so much money on giving birth in Hong Kong despite the better obstetric service here. Hence, the event of gate-crashing local emergency wards can be greatly reduced, so the frontline doctors and nurses do not need to deal with unexpected accidents like this. The pressure on them can be relaxed. We can also secure the high quality of service provided by the public hospitals. This also brings other benefits. Sufficient maternity wards for local mothers can be ensured. In the past, as the price of delivering babies for mainland mothers are 40% higher than the locals, private hospitals usually are more willing to receive clients from mainland. Many local mothers cannot book the hospital beds in private hospitals. If identity is not given to those kids, the demand for maternity wards for mainlanders would decrease sharply. Hence, the hospital will increase the proportion of receiving Hong Kong patients. Another remarkable thing is that the double no kids are not able to enjoy 12-year free education in Hong Kong as they are not admitted as Hong Kong citizens. Hong Kong taxpayers do not need to afford extra education expense. Isn't it just a good solution? My solution can also help to improve the relationship between Hong Kong people and mainlanders. We often have biased towards mainlanders because we think that they take advantage of us. Even not all of the mainlanders really have that intention. We suspect that they try to enjoy the economic benefits that we have built up so hard over the years. Hong Kong people are trying to protect our own interests and maintain our own living style. If my solution is used, Our suspicions and impression towards the mainlanders will be improved. Hence, the tension between us can be released gradually. Hence, re-establishing the common law is the only solution to solve this problem.